Hello, my name is Vera Verhagen and I'm a PhD student based in the University Medical Center in Groningen, and I work as a teacher in social work at the University of Applied Sciences, also in Groningen, the Netherlands. This video abstract is intended to give a very brief overview of a paper my colleagues and me recently published in the Journal of Child Psychology and Psychiatry. In this paper, we examined the association between care trajectories of children and adolescents based on duration and intensity of care and the reduction in psychosocial problems after 3 years. From previous research, we know that up to 1 in 5 children worldwide experience psychosocial problems, that is, behavioral, emotional, or social problems. It's important that these children and adolescents receive timely and effective treatment because these problems affect daily and social functioning. In addition, early treatment of psychosocial problems in childhood benefits health and development in later life. Randomized controlled trials on the effectiveness of psychosocial intervention have shown that some treatments for specific problems have positive effects. The settings of such trials, however, differs from the routine care provision in more naturalistic settings, where comorbidities are more common and treatments are typically less intensive. Therefore, we investigated long-term outcomes of psychosocial care for children and adolescents in a naturalistic setting. We described duration and intensity in trajectories and looked at problem reduction after 3 years. We used a prospective cohort study named Take Care, which is set up in the Netherlands. We followed children and adolescents after entering care for the psychosocial problems during a 3-year period with 5 measurement rounds. Various types of care were included: preventive child health care, child and adolescent social care, and child and adolescent mental health care. Problem reduction was measured with the parent report of the Strength and Difficulty questionnaire. Intensity of care regarded the amount of care in number of hours, and duration of care regarded the time period in months between the first day of care and the last day of care during the 3-year period. So what did we find? We found that children and adolescents with psychosocial problems who received care had improved outcomes at follow-up. The psychosocial problems of children and adolescents were reduced during the 3-year period, but the rate of decline was relatively less for children and adolescents with longer care duration. We also found that the higher care intensity does not automatically lead to a reduction of problems. The overall trend of problem reduction is positive and might be interpreted as an indicator of the quality of care. However, about a quarter of children and adolescents still received care after 3 years, and SDQ scores of children and adolescents with longer care trajectories improved less in comparison with children and adolescents with shorter care duration. A total reduction of problems may therefore simply not be achievable for a substantial group of children and adolescents. Psychosocial care may not always reduce problems, but may even then improve the functioning of adolescents. We will therefore focus on outcome self-reported functioning in our next paper. We will look at outcomes for adolescents with internalizing or externalizing problems or both, and investigate if these large diagnostic groups differ in self-reported functioning over time, and the role of care in those trajectories. But this is work in progress, so for now, thank you so much for watching.